Hi everyone, I am Demaya Williams and this is my health disparity presentation. Just to go over a few talking points and let you know what it's going to be about. First off, I'm going to tell you what health disparity I was assigned, give you some important health problems associated with it, why this health disparity is important, a theory that could explain the cause of this health disparity, and I'm going to explain the health disparity to you. So, first off, the health disparity that I was assigned with was tuberculosis in Hispanics and Latinos. So, not only are we going to go into detail about Hispanic and Latinos, but also and the disparities that are associated with them, but also tuberculosis specifically. So, first off, tuberculosis is a known pathogen and communicable disease. It starts in the lungs, but it can spread anywhere. It's spread through the air. So if I have tuberculosis or someone around me has tuberculosis, just the air that we share between each other can infect either one of us. So, first off, tuberculosis is an important health problem for any race to have, but specifically the Latinos and Hispanics because number one, it's very contagious. Number two, it can kill you without the proper treatment. So, Hispanic and Latinos are one of the minorities in the U.S. They don't have very much access to healthcare, treatment, or treatment facilities. And that's one of the main reasons why some of the health disparities they have exist. So, an explanation for the disparities that Hispanics and Latinos have is lack of transportation, lack of insurance, and low employment rates. So, of course, with employment, you would need money to be able to be financially stable and paying for any of the health problems you might have. Also, transportation comes into play because if you can't get to the proper healthcare facilities, then you can't, in any way, shape, or form, be able to help yourself or allow others to help you. And insurance comes into play because a lot of the treatments, even with tuberculosis, that you would need cost a lot of money. And without insurance, there are costs that most populations, and definitely not Hispanic and Latinos being a minority, can pay out of pocket. So, a health problem that I want to bring up to you guys is hidden chronic illness. And basically, it is when a race or anyone, a race, ethnicity, or anyone has a illness such as tuberculosis that they don't know about. And because Hispanics and Latinos are disparities, Hispanic and Latinos are minorities and don't have the same access to care that white America or the predominantly white Americans have, a lot of their illnesses go unnoticed. And because of this, a lot of Hispanics and Latinos die. And 1 in 4 Hispanic and Latinos live in poverty, which is 25% of their population. And living in poverty, not only do you not have the right transportation, insurance, and employment that you need, but you don't live in safe conditions. So, one theory that could explain the cause of this disparity is location. I think if you, we talked about location in a lot of our chapters in our class, and if you are put in a location where you're close to healthcare facilities, you're close to access, and you have the proper tools you need, you'll be able to solve or at least try and manage diseases such as tuberculosis. So, in closing, I would like to say that if we have prevention resources for the Hispanic and Latino community that can help them, this disparity can not only be can not only be eliminated, but we can try and move towards fixing other disparities in the Hispanic and Latino population. Thank you.